Allergy occurs when a person's immune system overreacts to a substance in the environment. This reaction is developed when the immune system reacts to a particular substance as though it's harmful. Many allergens are everyday substances that are usually harmless to most people. However, anything can be an allergen if the immune system has a specific type of adverse reaction to it. The immune system's tendency to overreact to a harmless substance is thought to be genetic. The term, atopy, can be used to describe this genetic tendency, in which the immune system is more sensitive to common allergic triggers that a person breathes in or eat. A person who has an allergy is described as being atopic. An allergic reaction can stem from certain substances, such as pollens, molds, foods, such as eggs, milk, nuts, soy, fish, animal meat, venom from insect bites and stings, natural rubber latex, and some medications. A substance that causes an allergic reaction is called an allergen. The first time a person is exposed to an allergen, they do not usually experience a reaction, as it often takes time for the immune system to build up a sensitivity to the substance. In time, the immune system learns to recognize and remember the allergen. As it does so, it starts making antibodies to attack it when exposure occurs. This buildup is called sensitization. Trusted source. One of the roles of the immune system is to destroy harmful substances in the body. If a person has an allergy to a substance, their immune system will react as though that substance is harmful and will try to destroy it. The immune system recognizes allergens as a foreign or a dangerous substance. As a result, the immune system reacts by making a type of antibody called immunoglobulin E to defend against these allergens. Allergens bind to these antibodies that the body produces, which causes an allergic reaction to occur. Histamine is one of these chemicals. When the allergen, such as pollen, enters the body, it triggers an antibody response. The antibodies attach themselves to mast cells. When the pollen comes into contact with the antibodies, the mast cells respond by releasing histamine. When the release of histamine is due to an allergen, this results in inflammation, redness, and swelling, which can be quite irritating and uncomfortable. It causes the muscles in the airways and walls of the blood vessels to tighten, and the lining of the nose to produce more mucus. This reaction is what usually leads to allergy symptoms being developed. People experience different symptoms, depending on the type of allergen and where it enters the body. Some common allergies include asthma, eczema, and food allergy. The symptoms of an allergy can range from mild to severe. The most severe type of allergic reaction is anaphylaxis, which may cause death without prompt medical attention, although rare. The severity of anaphylaxis often requires epinephrine injection, and where medical care is unavailable, a device known as an epinephrine autoinjector may be used. Some allergies are seasonal. For example, hay fever symptoms can peak between April and May, when the tree and grass pollen count in the air is higher. Hay fever, also known as allergic rhinitis, causes irritation of the nose, sneezing, itching, and redness of the eyes. Risk factors for allergy can be placed in two general categories, namely, host factors and environmental factors. Host factors include race, age, gender, and heredity. Four main environmental factors are environmental pollution, alterations in exposure to infectious diseases during early childhood, allergen levels, and dietary changes. In most cases, effective treatments are available to manage or treat allergy symptoms. There is no way to cure an allergy, but there are effective treatments available to manage or treat symptoms or to possibly prevent a reaction. Several medications may be used to block the action of allergic mediators, or to prevent activation of cells and degranulation processes. Some of these medications include antihistamines. These block the action of histamine, which the immune system releases during a reaction. Decongestants. These can help relieve a blocked nose. Corticosteroids. Available in the form of a pill, cream, nasal spray, or inhaler. They help reduce inflammation. Allergy immunotherapy. Useful for environmental allergies, allergies to insect bites, and asthma. Immunotherapy involves exposing people to larger and larger amounts of allergen in an effort to change the immune system's response. This can help a person develop long-term tolerance. A person will take gradually increasing doses of the allergen, either as a tablet or an injection. Leukotriene receptor antagonists. These are medications which may help with some allergies, if other treatments have not worked. The drugs block some of the chemicals that cause swelling. Many treatments are available over the counter. However, before using a medication, a person should speak to a pharmacist or doctor. Drugs will not cure an allergy, but they can help a person manage the symptoms of a reaction. In many cases, the most effective way of managing an allergy is to avoid the allergen that causes the reaction, although this is not always possible. If a person believes that they may have an allergy, their doctor will be able to help them identify what is causing the reaction. The person should be ready to explain any symptoms they have noticed, when, and how often they occur. What seems to cause the family history of allergies? Whether or not other household members have a similar reaction. The doctor may recommend some tests or refer the person to a specialist. Those at risk of an allergic reaction should take measures to avoid exposure to known allergens. For example, if you have a food allergy, you should check a food's ingredients list for allergens before eating it. Inform friends, relatives, colleagues, and others about the allergy and how to use the auto-injector. Consider wearing a medical identification bracelet with details of the allergy, and also, seek allergy testing to know which substances to avoid. We have made it to the end of this video. Thanks for watching, and see you soon.